Hi, I'm Derek Bryan, owner of Miramar Recovery Centers in beautiful Laguna Beach, California. The topic for this segment is comparing large institutional treatment facilities to small residential treatment facilities in a substance abuse treatment environment. Let me start by saying this is not meant to be an exhaustive or comprehensive explanation, rather just a broad overview of some of the differences that exist between the two sizes of facilities. As stated in the title, a residential facility is located in a residential neighborhood. It's usually a single-family residence that's been modified minimally to become a treatment facility. Typically, a residential facility accommodates up to about 6 clients per residence. Now, if there are a conglomeration of residences, maybe 2 or 3 together, you might find 18, 24, up to perhaps 30 patients. But that's usually about the maximum number of clients that will be housed in a residential type environment. Depending on the program, clients typically sleep 2 to a bedroom, they eat together, sometimes they prepare their own meals together in the kitchen, and really function like a single family unit. From a clinical perspective, small residential environments often allow for a greater customization or individualization of the treatment. In many instances, individual treatment sessions are provided from 1 to several times each week. The group therapy groups are smaller, usually anywhere from 3 to 6 in a group. From an activities perspective, there are often daily excursions and other activities or complementary therapies like massage, yoga, acupuncture, meditation, and others that you might expect would be available in a facility with fewer clients. Now let's talk about larger institutional-like setting facilities. These are often or most often not located in a residential environment, but they're often similar to what you might expect a hospital or a dorm room in college to be. Usually they house from 50, 75, upwards of 100 and even more clients at the same time in this type of a facility. Typically the rooms, like I mentioned, are dorm-like accommodations with 2, 3, sometimes 4 clients per room. They'll dine in more of a dining hall type environment, probably not be cooking their own food, but eating together. Clinically speaking, in a large institutional-like environment, it may not be feasible to provide individual treatment sessions or individual therapy. Therapy is most often conducted in group-like setting, and usually the groups are quite large as a function of the overall population of the facility. This does provide for a nice dynamic oftentimes and a lot of variety and exposure in terms of the participants in the group. In institutional-like facilities, there are often also lectures and educational type opportunities that you may not find so often in a small residential setting. The larger facilities may also have on-site gyms or other on-site activities areas for adjunct therapies and other activities that clients can do on-site without having to leave the actual campus. The question of whether to attend a small residential type facility or a larger, more institutional-like facility really comes down to the client and what their expectations and desires for treatment are. While the intent of this discussion is not meant to be exhaustive in any way, I hope it's been informational and helpful to you. Thanks for watching. For more information on substance abuse and dual diagnosis treatment, please call us toll-free at 888-300-3210 or visit us on the web at miramarrecovery.com.